Hello, everyone, and welcome to our presentation on understanding anxiety disorders, the causes, effects, and treatment options. We are glad you could join us today as we explore the complexities of anxiety, its impacts on our daily life, and the various treatment options available. Whether you're here to gain insight for yourself or to support a loved one, we hope to provide valuable information that fosters understanding and compassion. Our goal here is to create an open and informative space where questions are encouraged and knowledge is shared. Let's embark on this journey together to better understand anxiety disorders and the ways we can support those affected by them. Thank you all for being here, and let's go ahead and get started.
Great morning, everyone. My name is Dr. Jeremy Blunt, and I will be conducting this series, um, Our Mental Health Matters. And this one is Understanding Anxiety Disorders. Like Ms. Cushenberry shared we're going to talk about causes, effects, and some treatment options. By all means, there will be an opportunity at the end of this to be able to answer some questions. There is a lot around the topic of anxiety. So today, I hope to be able to provide some clarity, both for maybe yourself or someone that you know that may be dealing with it. So I'm excited about today, and I hope you're ready. So kind of let's get started with it. As she mentioned, these are the learning objectives that we have for today. To understand what anxiety disorders are and how they differ from normal stress and fear. Then we'll talk about the identify types of disorders. We'll kind of explain biological, psychological, and environmental factors that contribute to the development of anxiety disorders. We'll learn practical ways to cope with anxiety through things like self care, stress management techniques, and some mindfulness practices. We'll recognize the importance of social support, kind of talk about that, what that circle looks like, understand the real role of social support, which includes like family therapy and support systems. Then we'll understand various treatment approaches to including psychotherapy, medication, and lifestyle changes. So that's kind of our direction that we're going to go today. So to get started, let's start with what exactly is anxiety? We've heard a whole bunch about it. Um, and for those who that this is your first time in a session with me, I like to be interactive, so I will throw some questions out there here and there. And feel free to open up the chat, put your questions there that either I'll answer immediately or toward the end of the presentation, I'll go back and answer those questions. Um, and I like interaction, so I might throw a question out there um, to and I like feedback from folks. All right, so what is anxiety disorder? Um, Anxiety disorders are characterized as excessive worry and fear. Okay, excessive. So let me what I like to call parenthetically digress. Let me talk about another topic and then I'll relate it. So we're all familiar with the concept of abuse. By definition, abuse is abnormal use. Okay? It's whenever you use something outside of the context of which it was designed. That is what abnormal use is. So, just like a hammer can be used to build, but it also can be used to tear down. Or whenever you use something in excess, it ends up causing damage as opposed to something that helps. So, the same way we could do this literally with things, we also want to think about it when it comes to ourselves. It's like water. We need water. Our body needs water, but if we drink too much water, folks can drown, it can cause health issues. That is what is abnormal use. Using it outside of the context of what it was designed. Now, let me take it a step further and say, now, let's use that same idea about our thoughts about something. So when we think about worry, there are things that are we naturally think about and we are concerned about. There are some natural fears that we have. Like if you walk outside to your car and no lights are on in the parking lot, coming out of a grocery store, and you hear eerie sounds, like there is a natural inclination that you have, the hairs on the back of your head start standing up. You know, those that is a natural fear that you have. Anxiety is excessive, where it's not in those moments. It's when you have a fear that exceeds not just that moment, but every time you look around, you can't go anywhere. You're scared to leave the house. You're scared to do anything. And it is accompanied by physical symptoms like you start trembling. You might break out in a cold sweat. You have a rapid heartbeat. And it's something that becomes so repetitive that you look around and it's like it starts to interfere with everyday functions. These disorders differ from normal stress and fear in their intensity, one, duration. Intensity is a lot more than just in a moment. The duration is longer than a moment, and it starts to impact your life. I'm not afraid to leave home. I'm afraid to go and do things. And they can significantly interfere with work, relationships, and your overall well being. When you look around and normal facets of your life, they affect, then we have to look at it and say, okay, is this something more than just a normal? So let's talk about the different types that are out there. So there are, I pointed out seven, and I'll kind of briefly talk those. The first one is what they call GAD, generalized anxiety disorder. And it is just, um, it involves persistent worry and anxiety about everyday situations, things that just occur on a norm that you're concerned about. I'm concerned about walking out to the mailbox. I'm concerned about driving in my vehicle. I'm concerned about the people at work. Like you're constantly thinking that people are against you and the worst that can happen. That is generalized anxiety disorder. The second one is panic disorder, and it features sudden episodes of intense fear and physical symptoms, just because of certain situations that you may come upon, and it causes like rapid heart rate, a dizziness, a shortness of breath. You get so overwhelmed with the thought of what could happen. The mind is a very powerful tool. Your mind tells you things, and your body believes it. And this is the reason why, you know, certain things like this affect people in such a large way. Number three, social anxiety disorder, also referred to as SAD, is characterized by excessive fear and anxiety in social situations where they don't want to be around crowds, large amounts of people, really don't want to interact with people that they're just not, they don't know. Like again, these things are excessive. Yeah, there are some people that just don't like to be around people. However, there are those that literally they don't drive, they don't ride trains, they don't get on subways, they don't go to concerts because of a fear of interacting with people and being in social spaces makes them extremely uncomfortable. Then there is specific phobias. That involves intense fear of specific objects or situations, such as, fear of spiders, heights, or public speaking. The number one fear, according to statistics, for most people is public speaking, getting out there in front of people. This is a form of anxiety. Uh, Agoraphobia is a fear of open spaces, crowds, or situation that escapes might be difficult, where they turn around and they always feel, hey, I got to get out of here. I can't, not to say just open spaces, but I think closed spaces as well. If they walk in, the first thing that they're looking at Is the door? Which way to go? Um, these are a lot of the fears that people deal with. Separation anxiety disorder. It involves excessive worry and fear when separated from loved ones. They feel like they can't be away from their loved one. They're constantly wondering where they are. They feel like they got to go with them all the time. Um, and historically, we used to see this a lot in adolescents and kids, but you actually start seeing this more and more in young adults to adults. The concern of this is my comfort level being around this person, and I don't really see how I can function on a norm without being around them. And then what I like to call the most popular in the last maybe decade, post-traumatic stress disorder. The military made this popular, but truth be told, it was always there. It is triggered by a traumatic event and can involve flashbacks, nightmares, and avoidance behavior. It's where they've experienced something, and even though they're no longer in that traumatic event, certain things trigger those thoughts and bring those things back as if in their mind they're reliving it over and over again. So these are the top types of anxiety disorders. And then we're going to look at causes and risk. So, what causes a person to have anxiety at the end of the day? Um, I broke it down into about six different categories. And the first one is look at genetics. There are factors like your family history, your gender, and personality traits. You know, hey, this is males have certain things that they associate with it. I would also say ethnicity, because there are certain things that yes, there's a certain fear that comes along with those things. That hey, this is the way we've always done things, and being exposed to if my parent had anxiety about something, then sometimes that will affect how I see it and how I deal with those things. So genetics in many cases plays a large part in it. Personality traits, things that we're just comfortable with, things that we do naturally versus things that we're just, we just might not be comfortable being around in certain environments. Those things are genetic. Then there is environmental. Environmental are factors such as, like a stressful childhood or exposure to violence or upbringing. All of those environments play a large part. When we say childhood, we can say things like, hey, if I grew up in certain neighborhoods, if I heard gun violence all the time, it can affect how we respond to situations. If the only thing that I was exposed to were, like, for instance, police officers in a negative way, then or emergency personnel in a negative way, military personnel in a negative way, then it could cause me to that could contribute to anxiety whenever dealing with them later on or in different types of situations. Then there is um, brain chemistry and structure. Your chemical makeup, your neurotransmitters or genetics or structural changes in the brain, like how you connect with things and how things make sense to you or things that don't make sense or that whether or not you frame it to try to understand it. All of these things play a part and can contribute that. Some things you have control over, some things you don't at the end of the day. Um, Trauma and stressful life circumstances. These are what I like to call um, there are psychological factors such as cognitive distortions. Cognitive distortions are the things that we tell ourselves, hey, if I tell myself that nobody likes me or everybody thinks that I'm ugly, even though they could tell me something different, I can perceive what they're telling me and tell myself my own translations of it. Even if it's not the truth in reality, I've distorted the reality and gave myself a different thought process. And sometimes that is based off of past experiences, it's based off of traumatic events like abuse, maybe the loss of a loved one, or significant life changes that happen. All of these things end up being what people refer to as triggers. There are things that kind of, I'm doing fine at this moment, but then all of a sudden this one thing happens. And then all of a sudden I now end up going down this other direction. So traumatic and stressful life events that take place in our life also can cause or open us up for a risk of having anxiety being a major issue for us. And then there is lastly, medical conditions like thyroid problems or heart disease, um, different things that we're just concerned about. There are a growing number of people that do not visit the doctor because they don't want to hear bad news. They have an anxiety or concern or worry about receiving bad news and knowing what to do with it, or having to be in a situation. They'll easily tell you, well, I'd rather just not know because I don't want to wrap my mind around hearing that there's nothing that I can do about a situation. So a lot of times, again, and this goes back to kind of like genetics and family history. If you came up in a home where health and going to the doctor was not something that the family did or you saw your parents do, and it was not something they practiced, or they did not consult doctors and things of that nature on a consistent basis. They didn't do checkups and things of that nature. Then they developed this concern with and anxiety is also the part of the unknown, the parts of, well, I did not know that this was transpiring or these things were happening. And because I don't know that these things are happening, I immediately have this thought process in my mind of, well, I can't deal with this. And so I'd rather not be involved in it at all. So these are some of the causes and risks. Like I said, genetic factors, environmental factors, brain and chemistry structure, trauma and stressful events, and then medical conditions. So, how does this affect us? One, we kind of talked about physical effects uh, that it has on us. It could do things like, increase heart rate, like I said earlier, sweating, it just excessive, all of a sudden just break out in sweats, headaches, fatigue, having tension. These are physical symptoms. Then there are emotional symptoms. It can take an emotional toll on a person. Constantly worrying, fear. They could be very irritable. These are different signs that, hey, all right, anxiety is affecting. It's like you turn around and every little small thing kind of sets you off and bothers you. Social impact, it will affect how we interact with other people. It'll cause some people to withdraw from social settings that they were comfortable in. They will withdraw from family, friends. They all of a sudden want to deal with people, don't want to be involved. And not just a, hey, I need a moment, but just all of a sudden just not wanting to do anything, not wanting, and these are things that happen over a extended period of time. These are not isolated effects. That when you start seeing it's a way like they don't ever want to be around anybody anymore, or they never want to deal with these things, they're saying, okay, there may be something a little bit more here. And it starts to impact daily life, school and work performance. It affects your concentration, affects productivity. All of these different things are the ways anxiety affects you. So when you look around, you're like, okay, the things that maybe I was used to doing, or if you're looking at someone else and they were used to doing and it was a norm to them, then all of a sudden is no longer those things. So when it comes to treatment of these, remember this is excessive worry or concern. I can't keep iterate that enough. It's not just isolated. This is excessive. There are several different treatment options, and some of them work in combination. Some of them work isolated. I will tell you psychotherapy, such as cognitive behavioral therapy, often referred to as CBT, or even exposure therapy, are the most common types of therapy. CBT is really effective when it comes to talk therapy. It helps individuals identify, some negative thought patterns and some negative behaviors, or some negative thought patterns that are causing some behaviors that honestly are just not beneficial. Exposure therapy is another type of CBT that also has been proven effective. And exposure therapy is really to gradually expose you to certain environments and certain things to help build your confidence and lower the anxiety of those things. Those, in combination with things like medication, are also commonly used to treat anxiety. There are steroids in uh, uptake inhibitors, also referred to as SIRs, or um, they're antidepressants or beta blockers. And when it comes to medication, I always encourage people that number one, medication should never be the one size fit all solve for everything. It does not escape the behavioral things that also you need to work on, which is the reason why I pointed out CBT first, because I believe it works in combination. That, you know, for some, just CBT therapy or exposure therapy may be enough, but to some, it may be therapy plus medication. But I never say, hey, it's just medication, because you should not depend just on medication to solve your issue for you or to fix things. It should be a combination, because hey, there's work that you still have to do on top of it, which also leads to lifestyle changes. There are things that need to be adjusted or looked at. How do you manage stress? Do you have a regular exercise routine? How are you getting proper sleep? Some relaxation or mindful techniques, and I'll talk about those in a moment, such as deep breathing and meditation. All of those things can reduce symptoms. Another form, and I have listed there treatment options, is like a support system. That includes friends, family, therapists, and counseling, even uh, in providing those emotional support and coping strategies that help you with a deeper sense of belonging and understanding about things that are going on around you and how to deal with those things. And then, of course, there's also alternative therapies that are out there, like acupuncture or aromatherapy, and some people find those things beneficial to help them manage it. But if you notice, if there's a screen that you would like to take a picture of, this will be one of them that I would recommend, specifically in the order that it is: talk therapy, medication, lifestyle changes, support system, and alternative therapies. I put that one way last because I do feel like it's alternative. The other areas should be addressed first and fully explored before I would encourage anybody to go to the next one. And then we have coping strategies. So, how do I deal with this? If I'm dealing with these things, what is my way of kind of wrapping my mind around it? The first one is to build resiliency, and that involves what you're doing for you. It involves developing a positive coping mechanisms and strengthening your ability to adapt to changes. And you do that by, what are you telling you? And how much are you building you up? There's a conversation that we all have with ourselves. And most times we ignore that conversation. But it is the most powerful conversation. When I do this in person, I like to ask folks in seminars, does anybody talk to themselves? And it's so funny to hear some people are hesitant to raise up their hand, and other people look around and like, I'm not doing that. And then you got some folks that they raising up their hand like, and I always joke and say, now, I didn't ask if anybody respond to themselves. I just said, talk to yourself. Responding to yourself, that's a different conversation we'll have to have that one later. But we all talk to ourselves. We have that voice, even while I'm talking right now. You have that voice in your head that sounds like you, because it is you, and you're running through things in your head, um, and how things go. That is the most important conversation. Thank you so much, Danielle. I see your comment in the chat section. You said, I talk to myself very often. We do it every day. All of us do. We're constantly telling ourselves these things. That is the conversation to pay attention to. And if you find that is a challenge for you, then sometimes getting someone, a professional, to help you really understand and be able to recognize that conversation, because sometimes it's so comfortable to us. We're telling ourselves something that we don't even realize that is actually something that we're telling ourselves. And the same way that you can tell yourself something negative, you can also use that same voice to tell yourself positive things, to build resiliency. Resiliency is simply your ability to bounce back. It's not that you're going to stop the negative conversations, but you have to be able to build the voice of, okay, when I hear it, what do I need to tell myself so that I can put myself on the track that is productive for me? Then there is step two is identifying triggers to avoid stressors that can help reduce levels of anxiety. What kind of things set you off? Certain environments, certain people, certain conversations, certain things that you do. Being able to, okay, what things cause me stress? Certain conversations, hey, I might not be able to engage in that conversation, or I might have to cut that one short early, those kind of things. Self care practices, such as regular exercise, healthy eating, significant sleep, all of these things are coping strategies. Incidentally, the next presentation that we'll have, our last one in this series, which will be April 15th, will actually be dedicated to self care. So I invite all of you to come back. Make sure you tune in for that one because I'll be sharing a lot of techniques and things about self care. That was my little plug. All right. So, and then there's number four is mindfulness and meditation techniques. Can help you calm your mind and reduce stress. Different things that you can do. So, coping strategies, build resiliency, identify triggers, self care, and mindful and meditation. So, you're saying, all right, so maybe it's not me that deal with it, but I deal with other people and I recognize that they're having issues, and I want to know how can I help them. Well, here are four little things that I would encourage you to do. Here's the first one: encourage open communication. How do you do that? You do that by having what's called non-judgmental communication. You're supporting someone. You don't judge them by the things that they say. You allow them to share. Eye contact, being understanding. Don't try to just tell them, hey, just get over it, or downplay what they're saying, but really listen to them. Listen to understand where they're coming from. Emphasize, exercise empathy. Try to relate to where they are. One of the worst things that we tell people though is, I know where you're coming from. No, we don't, because we're not them. We haven't had all the experiences that they've had, so we don't see the world like they do. So instead of saying, you know, I see where you're coming from, or, I know just what you mean, no, I can see that as something that could probably be a lot. And I can only imagine what you're going through right now. But I can imagine and for it to be affecting you the way that I see, I can tell that this is something that is big, and what can I do to help? Be patient and understanding. Highlight that, hey, getting help is crucial. Recovery is a process, it takes time. It's not going to be an overnight solve. You're going to have to be understanding, hey, I'm going to walk through this with you. you know, Help with practical support, things that you can do, like offer to attend a therapy session with them. Encourage healthy habits. I'll work out with you. We could eat a balanced meal to be, you're eating healthy, I'll eat healthy. What can you do to say, I'm in the boat with you? I may not be seeing it the way that you see it, but if me being there with you helps your process feel more feasible and more um, as something that you can go through and encouraging, then doing those things. And then and don't minimize the experience for them. Encourage people not to minimize what they're going through, and you don't do it as well. Don't say things like just relax, it's not that big of a deal. Anxiety is a big deal. Anxiety disorder is a serious condition that requires understanding. Again, going back to empathy. and exercising those things. So that is how you can help someone that may be dealing with anxiety. But I also would say you need to know when to tell someone to get help, to seek professional help. When it becomes overwhelming and it starts to affect daily life, daily functions. Okay, I was being there with you, and I'm being, empathetic, and I'm being understanding. But when they don't seem to be making progress, and it seems to be affecting more and more, saying, okay, when self-help strategies aren't working, things like relaxation techniques or those lifestyle changes aren't working out, and all right, now it's time to go and talk to someone else to see what else can be helpful when these things start affecting physical symptoms, like they're having chest pains and difficulty breathing, and they're starting to have issues doing daily functionable things. I always look. You may need to encourage them to go see their healthcare provider and get evaluated there. When it becomes a physical symptom, first part is before they go to a therapist. Hey, have you talked? When was the last time you went and did a checkup? Because that healthcare provider can, you know, recognize some things. They're going to ask some pointed questions and help give some directions on that end. If you're unsure, recommend that they go and hey, I'll go with you if you don't want to go by yourself. Again, when it's physical symptoms, there are other things to look at. If there are ever any thoughts of self-harm or suicide, in those moments, you immediately seek out professional help. Um, Seek help from therapists or counselors or a professional. That is always vital in those moments. So, in conclusion today, kind of talked a lot about the different types that we went over. We talked about um, the causes and some risk and when to recognize it both in yourself, when to recognize it in others, some daily things that you can do about anxiety. Anxiety, remember, is excessive worry or fear. And there's some things that you can do for yourself, but when it starts being either physical symptoms appearing or, rapid heart rate, sweating, etc., causing health issues, or, hey, might need to consult somebody. When they don't want to function, it starts to interfere with work and school and all of those different things. Seeking out the proper help is essential. It's important to remember that anxiety disorders are treatable. There are a lot of different resources that are available, and to help you manage the conditions with proper treatment and support. People live with anxiety and they live full and healthy lives. So that is kind of the overview today for anxiety disorders. I do want to open up the floor for any questions that anyone that may have. So I like to use the chat section. Give you a couple moments. If you would have any questions that you have, I'll be glad to answer those. I'll also like to throw out my information that if there's anything that I can do to assist you, be glad. Me or anyone at my office will be glad to do that. Seeing none, I always like to conclude by encouraging folks to follow me on social media. There are a lot of different things that we do and a lot of different services in different ways of things that we do in and throughout the community. So with that being said, thank y'all so much. Ms. Cushionberry, I'll turn it back over to you.
Okay. Thank you so much everyone for attending today's presentation. We really appreciate it. And this presentation will be stored on our newly designed mental health awareness page on our website. And if you want to go out there and take a look at that page, you may click on quick links, I believe it is. And in the quick links drop down menu, you'll see mental health awareness link under the Lola link, and it will navigate you to our mental health awareness page. So usually takes about 24 to 48 hours before it lands on that page. So maybe sometime by the end of the week or at the beginning of next week, you'll be able to access that video there. And any of the previous videos that we've conducted this semester. So again, thank you all, and I hope everyone have a great rest of their day and enjoy the rest of your week. Bye bye.